This is the second webinar in our series to help you instantly have a functional medicine practice. It's much easier than you think, as we will demonstrate. I'm Dr. Paul Barnes, and I think learning this material is very important. And I'd like to stress that this is kindergarten. I've spent some time watching other webinars and going to other courses and noticing if I had no background in this, how would this affect me? And I think sometimes the education in natural health care prevents us from following through. Every presenter has a point of view, including me. Whatever I present here, you might find other ways of doing things. I know there's people that are not going to agree with some of the things that I say, and that's the nature of the beast. But the good news is we aren't really treating disease. We're actually peeling an onion, or we're taking straws off the camel's back. So anything you do is right. And even though you might think that, oh, I have to do it a certain way. I'll give you an example. You talk about COVID, for instance. If you read someone who's very much into the microbiome, they will correctly tell you that fixing the gut will prevent the cytokine storm, prevent terrible COVID from happening. They'll make the argument that people die of COVID because they have poor gut function and they're already inflamed. But you'll look at something by Dr. Brownstein. Brownstein has gotten 109 COVID patients out of 109 patients better with his antiviral treatment. Now, neither is better than the other. They're just different ways of approaching things. You can also read research where you find that if a person has enough vitamin D, that they won't get the cytokine storm, they won't get bad COVID, they might still get the disease. There's a Polish researcher that found if you're getting 500 grams of vegetables a day, you won't get COVID at all. So there's all this information, and when you go to seminars, you sometimes get the feeling, okay, who's right? And the answer is everybody is, and everybody misses something, and that's true of this as well. And I think it's important that we learn this material because a million people just died, mostly because our medical system doesn't believe in natural health care, and also it's built around getting patents, and none of the things in natural health care are patentable, so they just ignore them. A good example is heart failure. I mean, you could make a really good case that if someone's got heart failure, if you give them enough CoQ10, as much CoQ10 as they can afford, they're going to live better, longer. Magnesium is depleted by most of the cardiac medicine. So if you give someone heart failure magnesium, usually thiamine and CoQ10, they're going to do much better. But none of these things are patentable, and I've actually had cardiologists take CoQ10 away from my patients. So this is important that you do it, and my goal is to have more doctors do this kind of work. The more of us that do it, the better our healthcare system is going to be, because people start saying, hey, this guy got me better. How come you're not doing that to the pharmaceutically trained medical profession? The important thing is to not be intimidated and realize that anything you do is right. The question isn't whether you did the wrong thing or not. The question is, was it enough? And by way of disclosure, I work with Zorix International. I do some writing for them. I like them because they're independent. They're never found on Amazon, and Dr. Harry Eidner helps them with their formulas and consults with them, and they have very good products. So I created symptomquiz.com as a way for someone who doesn't do much nutrition to come up with a credible treatment for their patients. The site is not so much about treating disease specifically. It's about finding areas where your patient may need support and giving you advice on what to do for them. And if you have a concept of not treating disease but supporting infrastructure, this is a pretty good way to start. The site is free. My web designer tells me that for a certain fee, and he's doing it as cheaply as he can put it on your website for you. When a patient takes the quiz, they'll get a score in certain categories. The ones in red are the ones we're going to talk about today. HCl and enzymes or upper GI digestion, allergies and sensitivity, need to heal the intestinal mucosa, and microbial issues in the GI or dysbiosis. A lot of those are interrelated. Then there also vitamin need, gallbladder issues, needs for immune support, insulin insensitivity, stress and adrenal, and hypothyroid. And then there's a total digestion score and a total health score. The digestion score and the health score are like golf scores. You want them to go down. The scoring of each category will be either mild, moderate, significant, or major. And if you don't have a background or if you're busy with other patients doing other things, you can actually set up a wellness score and simply treat one of the major categories. They might have several major categories. Find the one and treat it. I have a manual for you to do that. Give them the supplements and give them the roadmap to health diet. And then in 30 days, retake it, and you'll end up treating a different thing. And you can continue like that, and eventually patients will get better. Utilizing nutrition in your office yet, this is a good way to do it. I have this poster. I can customize it for your office. It asks what's your wellness score. They can take the quiz. You give them a 30-day program and then retake it. And what they'll notice is that the score improves. And you can run a wellness program almost on automatic pilot because, like I said, we're not treating disease, we're fixing infrastructure. I wrote this PDF and it's available to you. Email me. I'm happy to send it. This is how to use Symptom Quiz, and it's set up for someone who just wants to have a wellness plan, wants to do something reasonable to help their patients. What you'll do is you'll find one of the categories where they have a major and have them do the roadmap to health diet, and then it's got supplement suggestions for you, both as a quick cookbook. In other words, the no-brainer, you're not going to do any harm with this. I call it a quick cookbook. And there's also a discussion that can help you develop a more nuanced plan for that. And this is a good start. And some of you might want to use this for the first 30 days and then get into what your patient's issues are, do a little homework, and create a treatment. And like I said, don't be afraid to do that because you're never wrong. We're taking straws off the camel's back. Anything you do will help. The question is it enough? And there's resources. Vitamin companies have consultants to help you. Lab companies have consultants to help you. You can email me and come up with things. And even if and one of two things is going to happen. You'll get the patient better, and sometimes you'll be stunned at how simple it is to get somebody better who's been suffering a lot, or the patient will teach you something. But if you do this, you can't hurt anybody, and you're going to help a lot of people. The mainstay of these treatments is the roadmap to health diet. It's nutrient dense, it addresses digestion, it's got a low glycemic load, it balances the microbiome, which is some of what we're going to talk about, and a lot of the common food allergies are not in there, like soy and dairy and wheat. One possible problem that you might have with this is Americans are addicted to junk food. The junk food companies work on making it addictive. And you might have problems with compliance. That doesn't mean you can't treat the patient. What you want to do is move them towards the changes that are in the roadmap to health, and you can make up for a lot of it with supplementation. We're going to talk about the microbiome, and you can treat the gut and treat the digestion and offset a lot of the damage that a poor diet will do. And what I found is the non-compliant patient over time, a lot of times, starts improving their diet and will do better. Nutritional consultation is a negotiation. Okay, and we sometimes have this fantasy that we're going to give this perfect program, it's going to fix them, and it's like an actual treatment, and kind of like you take a massive antibiotic and get rid of pneumonia or something like that. And it's one of the good lines that I always heard was the road to good health is always under repair. So that you'll have ongoing treatments with this. There will be things that you will learn with each patient that you might tweak what they're doing. You might have compliance issues and try to make that up with supplementation. A lot of you are chiropractors adjusting the whole straight chiropractor, get the nervous system working. That works. I've actually found that as a chiropractor, I use less nutrients than medical people doing this kind of work. Okay, so the first category from symptom quiz we're going to talk about is upper GI digestion. This will mean the patient either needs HCl for the stomach or pancreatic enzymes. And let me say, I use HCl. I've gotten good results with it. If you look at the research, there isn't a lot to back it up, but there are literally thousands of clinicians that are using it and getting nice results with it. The need for pancreatic enzymes is recognized by the medical profession, but these are patients that have gas or bloating soon after eating. Their fingernails break easily, which is definitely HCl. Vitamins cause nausea, that's for sure HCl. A lot of your reflux patients need HCl. It seems counterintuitive, but it's true. They feel better if they don't eat. They don't want breakfast. A lot of vegans actually need hydrochloric acid. They got there because all meat makes me nauseous. I don't want to eat it. Find out if it's a moral thing or if it's how they feel when they eat thing. Fatigue after eating is another sign, but that's also true of insulin insensitivity. There are things you can do to confirm if upper GI digestion is a problem in blood chemistry. The blood chemistry ones are mostly about hydrochloric acid. Balancing the Body Chemistry has a blood chemistry manual to teach you how to read normal, quote unquote, normal blood chemistries and get really good information out of it. If their serum phosphorus is below 3, gastrin's less than 45, low to normal protein, calcium and iron are normal to decreased. The big one I like is MCV. MCV will go up as a patient needs B12, and if it gets in that 90 range, chances are they're not making enough stomach acid. Their bun will be increased, and there'll be an increased anion gap. Now, anion gap isn't so much because of the acid, but people that are deficient in B1 will have an increased anion gap, and they will tend to be hypochlorhydric. Alkaline phosphatase below midline usually means they need zinc. And people who are deficient in B1 and zinc tend to be hypochlorhydric. The Heidelberg Gastric Analyzer is a novel thing. The patient swallows a little capsule that's actually a radio transmitter and measures pH in the stomach when it goes through and sends a signal to a machine, and you get an idea what their pH is. The stool testing will look into this, but stool testing companies are mostly all about pancreatic enzymes. They'll look for enzymes. They will look for fat, undigested fat. They'll look for undigested food in the stool. I do applied kinesiology. I mentioned it here. I'm not pushing that you should do it, but pectoralis major clavicular is a stomach muscle. If you find it weak, and I use lingual testing. I've had a cash practice for a long time, and people are always looking for inexpensive ways to get better. And I found AK very useful for that. It's a two-edged sword because it's very prone to operator prejudice, and if you're hell-bent on finding something, you tend to find it. But every once in a while, you'll take a muscle test, find something weak, and the supplement will just make it like you could do chin-ups on it. It would be so strong. It's usually very striking when it happens. You'll see a pectoralis major clavicular also weak with expiration. They breathe in, the muscles are strong, you breathe out, and it's weak. It can happen the opposite way, but usually it's with breathing out. Cranial faults, temporal bulge, and other cranial faults. Like I say, I'm not pushing AK, but I figured I'd mention it here. Here's a partial list of conditions where practitioners will give HCl for the stomach and get pretty good results. A lot of times they add other things, but for gastric reflux, oddly enough, hydrochloric acid is a good treatment. A lot of your allergies and asthma patients, there's a group of doctors that will swear by that's what you do. You make sure they have enough hydrochloric acid. IBS and SIBO usually have to do other things, but a lot of times HCl is a mainstay. Dysbiosis and leaky gut, especially parasites. Jonathan Wright says if you swallow a parasite and you've got enough hydrochloric acid, then it's a protein supplement. If you end up with parasites in your GI, there's a very good chance that you're not making enough hydrochloric acid. Arthritis and osteoporosis. As people get older, they make less hydrochloric acid. You'll notice old people tend to like sweets and desserts, and they don't eat so much protein. That's because they're not digesting it so well. And a lot of times giving hydrochloric acid will improve those conditions. If a person's not making enough hydrochloric acid, they very likely will be deficient in B12. They'll be deficient in essential amino acids and in most minerals. I put depression down there because there is a strong connection between depression and actually other mental health issues, including stress and anxiety, that are related to GI issues. Exocrine pancreatic insufficiency, or EPI, is something that the medical profession does recognize. They won't recognize any HCl need. In fact, for most digestive problems, they want to suppress hydrochloric acid. But this is off of WebMD or one of those sites. This is what they say are the symptoms of EPI: abdominal pain, gas and bloating, constipation or diarrhea, fatty stools, pale, oily, foul smelling. To that I would add a need for thinning the bile, biliary insufficiency, which we'll get to in one of the other webinars, unexplained weight loss or failure to thrive in infants and children. Once again, from an AK point of view, pancreas is latissimus dorsi, and you could lingually test pancreatic enzymes and see if they help. So testing for EPI, fecal elastase tests, fecal fat tests, pancreatic function test, which is pretty invasive. It's done in a hospital. You're probably not going to do that. The GI map from Diagnostic Solutions Lab, and actually other GI testing facilities, will test for fecal elastase and fecal fat, and also they'll tend to look for undigested food in the stool to see if that'll help. In the PDF that they offer that goes with symptomquiz.com, my quick cookbook or automatic knee-jerk kind of treatment is to give 1 to 2 8-X pancreatin, which is a pancreatic enzyme from Zorix International, with each meal. It does not recommend HCl until you've read the whole section on treating with HCl. The reason being that sometimes a patient will really need HCl, but you'll give them the HCl and it'll cause problems for them. We use GERD, gastric reflux, as our model for how to treat people using HCl. Goodhart postulated that hydrochloric acid was needed for the pylorus to open, and if you don't have enough, the pylorus stays snapped shut, pressure builds up in the stomach, and the acid ends up in the esophagus. So acid reflux isn't too much acid. Stomach pH is supposed to be 2. It's that the acid's in the wrong place. Other models include you can't suppress bacteria, so you get like a bacterial gastritis. There's other docs have suggested that if the stuff isn't digested by HCl, it rots and you end up with sulfuric acid and nitric acid and other things like that. But for whatever reason, people who need HCl very commonly get GERD. And it used to be, back in the 80s, automatically just give HCl. I would do hands-on technique for hiatal hernia or whatever, and people would get better. Lately, now, because of a lot of the new drugs in that, hydrochloric acid will aggravate the symptoms, especially if they're on proton pump inhibitors, like Prilosec. So I usually have to give them some kind of thing to soothe or heal the lining before giving them the hydrochloric acid. Zorix makes a product called GI Complete, which is cabbage-based, vitamin U. You can look it up. Biotics makes a product called Gastrozyme, which is just vitamin U. GI Complete has other things like aloe and DGL. And Deglycerinated licorice is another thing that's commonly used, but you have to monitor blood pressure with that. Glycerizin is in licorice. Licorice can be used as an adrenal supplement because it ramps things up a little bit. And deglycerinated licorice, just like decaffeinated coffee, they take the glycerin out of it. Unfortunately, there's always a small amount. Some people seem to be really sensitive to that, so you give them DGL and their blood pressure goes up. So it's a good idea if you get a product with DGL in it to monitor the blood pressure, because every once in a while blood pressure will go up with them. But in general, to be on the safe side, I would give somebody GI Complete for 2 weeks, and then slowly add the HCl. And of course, use the roadmap to health diet. A lot of these patients, they eat too fast, so you want them to eat slowly, chew their food in liquid. And they eat a lot of starch and wheat especially. So sometimes the foods that they're eating causes the problem. There's hands-on technique. There's a hiatal hernia technique. If you use a percussor, you can use it to open the pylorus or open the bile duct, or you can even do that with your fingers if you do any kind of visceral manipulation. I found that to be very useful. HCl Complete is the hydrochloric acid products from Zorex. A lot of other companies make HCl, and basically you have once you comfortable that it's not going to bother them, you have them take one pill halfway through the meal, and then day to day you gradually increase the dose until they get a warm feeling in their stomach. Once again, if they've been taking antacids, they give them GI Complete for a couple of weeks before giving the HCl. Another thing that can cause gastric reflux is thickening of the bile called biliary stasis. Zorex makes a product called GB Complete, which will thin bile. These people all have dry, itchy skin. They may have cracked heels, greasy foods upset their stomach. And I've actually seen, I remember I had one patient in particular, worked at Burger King and ate all her meals there, was on 3 different anti-reflux meds, still had reflux. We poked her under the rib, under the right rib, positive Murphy sign, and she went, yeah, she had gallstones, you know. So problems with the gallbladder can lead to reflux. Asthma is another one of those things that a lot of times if you get the patient's digestion working with HCl, they'll just do a lot better. I always figure that if while you're at it, you might as well look at it, well, it's about inflammation and bronchoconstriction. So once again, roadmap to health diet, which is anti-inflammatory. Magnesium is widely researched for use in asthmatics. IV magnesium has been shown to stop an asthma attack. And if they're hypochlorhydric, they're going to be deficient in magnesium and a lot of other minerals. And I'll give magnesium to bowel tolerance, which means you want it on an empty stomach, last thing at night, take 1. Well, first night's 2, 3. When the stools get soft, you back off. So you get as much magnesium in them as possible. Use taurinate because taurine is also an antioxidant. And of course, HCl. And sometimes bowel support. There's a link to parasites. I remember, oh God, in the 1980s, Science magazine had an article called "The Worm Asthma Controversy" and found parasites in asthmatics. Stubborn cases, you might consider doing a stool test, seeing if there is a parasite, and what you can do to kill it. Iodine will thin mucus, and I'm going to take a minute. Dr. Brownstein's book on iodine is really eye-opening. Once again, when you read something like this, it sounds like, okay, this is like a panacea. I know he talks about Hashimoto's disease, which is autoimmune, and we'll talk about autoimmune a lot. If you talk to somebody big into the gut, they'll say, oh, you're not doing nothing if you're not fixing the gut. And he will say if you give enough iodine, you can actually fix Hashimoto's disease. Like I say, it's an interesting book. And I think you should test for iodine before there's a lot of companies make these high dose iodine pills a lot of times. Every once in a while it's a problem for patient. There's a number there for Hackala Labs. They do an iodine test, which it's basically you challenge. You take a high dose of iodine and then a 24-hour urine. Ideally, most of the iodine ends up in the urine. If it does not, it means that the body's utilizing it and there is a need for iodine. Dr. Brownstein goes into more detail in his book. Like I say, asthma, you're not really treating asthma, you're fixing infrastructure. Patient with asthma is telling you got inflammation and bronchoconstriction. So a lot of times vitamin C and quercetin, other antioxidants are well researched. They've done high dose C. Vitamin A will protect the membranes. Some guys use lung glandular tissues. It's interesting. There is research to show that when a patient ingests glandular, that material ends up, if you take lung glandular and you radioactively label it, it will end up in the lungs. If you take adrenal glandular, it will end up in the adrenals. Some people just do cleanses. I don't want to get into that too much. And they might have allergies, gut issues. If you talk to somebody that's big into the microbiome, they'll say just fix the gut, inflammation will go down. Sometimes there's chemical exposure. They might need trace minerals. We'll talk about that in a minute. And mold a lot of times. Humidifiers a lot of times will grow mold. If they have a dust mite allergy and they're using a humidifier, they might make the dust mite allergy worse. Ask them about a CPAP. You put water in those things. Once again, they become little petri dishes. And another common thing is adrenal support. So these are all things you can look at for your asthmatic patients. Allergies is also a category of its own, but it's also tied to digestive health, of course. And there's a lot of docs that will use hydrochloric acid and change in diet and to treat things like hay fever, allergy, sinusitis, things like that. I think it's sometimes a good idea to take a green pharmacy approach like that. There's a number of herbs and other components that will help with allergy. AHF, antihistamine formula from Zorex, is such a product. Most companies make something like this. I was going to get into what the different herbs do, but then this turns into an herb lesson, and I'm trying to do an overview. Kindergarten, you can look up different components, and companies that make these things will have literature on it and what the research is behind what they're doing. Another thing that's useful for allergy is vitamin A. Vitamin A in general, I found, a number of patients that their allergies improve when they take enough vitamin A. If the patient has itchy eyes, it's one of those silver bullets. You can take it to the bank. Give them 25,000 units of vitamin A for each day for a week, and usually that clears up that symptom. They may need zinc also. Quercetin and vitamin C, that combination is also, kind of like the same as the green pharmacy approach. Some people do cleanses. Commonly do adrenal support. When I first got into practice, if I had someone with allergies, hay fever, whatever, I would do adrenal support. And at the time I was using standard process, and I had a product called Antranex, which is actually a liver extract. In the 1920s, the Japanese found that certain liver extract helps with allergies. There's a guy named Harrower came up with a product called anabolin. There's a similar product here. Anabolin is trademarked, but that's in AHF. So AHF is a herbal product, but it also does some liver support with it. And it's interesting because if someone gets a liver transplant, they tend to get the allergies of the person they got the liver from. The amount of chemical exposure is unprecedented in history. There's glyphosate and everything. The CDC found that the average American has 150 toxic chemicals that they're carrying around with them. 77% of us are walking around with plastic in our bodies. And some people are very sensitive to this. Also, some people have jobs, like beautician or auto mechanic or something, where they get a lot of chemical exposure and they'll just become very sick. They'll be allergic to everything. If you read any of Theron Randolph's stuff, you'll see that this is a big deal. They can't eat foods and things like that. It's been found you get high doses of vitamin C and quercetin along with trace minerals, sometimes B6. Patient need with B6, if they have a SGOT or SGPT or ALT or AST less than 10, that's in blood chemistry, that's usually a sign that they need B6. They'll have hidden food sensitivity. One thing that helps with that is thymus tissue. You avoid the foods that are bothering you, and you add thymus tissue to the mix. That's in a Zorex product called Immune Plus. A number of other companies make thymus glandular. Thymus glandular, interestingly enough, is one of the more better researched glandulars. And environmental illness is a whole topic on its own. It's a vast topic, and like I said, this is kindergarten or nutrition 101. They're just giving you an overview. So just going to show you that it exists, and sometimes trace nutrients help. I know if a person, for instance, is bothered by perfume. A lot of times they need molybdenum. Molybdenum is a cofactor to get rid of aldehydes, ketones, and sulfites. And if they're deficient in that, they'll react to those things. I figured if they're deficient in one trace mineral, they're probably deficient in others. Biotics Research makes a trace mineral product called Basic 9. You can give them that and some B6 and as much C as you can get into them. A lot of times they can't tolerate the taking the supplements. You have to play it by ear. And like I said, there's webinars, there's other things that will go into this in more detail. Another group that's likely to need increase in stomach HCl are senior citizens. HCl production decreases with age, and a lot of times I'm going to talk about B12 a little bit because B12 levels will go down. If you see an MCV greater than 90, you might look at this as an issue. If you can find it, there's a great interview from Kirk Hamilton, who used to do Clinical Pearls, talks to a Dr. Goodman about B12 and Alzheimer's disease, and Goodman maintains that B12 levels will, if they get low enough, will mimic Alzheimer's disease. And he did CAT scans on people, found out that there was no degeneration of the sulci, but they still had Alzheimer's symptoms, and he would treat them with high doses of B12. And usually talk about if you're not digesting, oral B12 isn't so good, but the Swedes, I think it was the Swedes, did some research and found that if you get milligram amounts of B12, 1, 2, 3, 4, 5 milligrams a day, enough of it gets in that you can actually make a change. So if you have an older person who's kind of forgetful, depression's another issue, and they got an MCV over 90, you want to give them a lot of B12. And also consider, do they need hydrochloric acid? And thing about hydrochloric acid, if they've got arthritis, a lot of times they're taking Advil and stuff, and guaranteed you give them hydrochloric acid, it's going to bother them. Phosphatidylcholine has been researched. Give 2 or 3 times a day. Zorex makes one. Will help heal up. Phosphatidylcholine is very good for cellular repair, and that's a good product to do it. The other thing you would consider with these people is they're going to have leaky gut, and we're going to talk about that in a little bit, and you want to do things to help heal the gut. And eventually, if you can get them to tolerate the HCl, that'll help a lot. And you want to get natural inflammation control for them, because the NSAIDs, it's a two-edged sword. Short term they help. Over long term, they actually create inflammation by irritating the GI tract, and they're making the situation worse. It's also been shown that these things actually destroy cartilage and maybe interfere with bone repair. There's a number of products out there that are herbal based. I don't use them so much, because you take them every day, and it's like usually it's 2 or 3 of them 3 times a day. So it's a lot of pills, and old people are already taking a lot of pills. I like 8-X-pancreatin. Pancreatic enzymes on an empty stomach will reduce inflammation. And if they're having a particular problem, have it do it here and there. That's a nice approach. Changing their oil. Fish oil is well researched, but most of the research is short term. Also, it looks really good on paper because most Americans have a 30 to 1 omega-6 to omega-3, and the omega-6 oils they eat aren't very good. So you give them an omega-3 oil and you see really nice short-term change. Long-term, once again, the oceans are full of plastic. There's all kinds of chemicals in fish oil that don't get tested for even among reputable places. And long term, there's some evidence that fish oil causes problems. So I like sunflax. It's a flaxseed, sunflower based, and 3 to 1 omega-6 to omega-3, which is the healthy amount of oil to take. You want to get them moving. You want them strengthening the muscles involved with the involved joint, and also make sure they get enough water. People with osteoporosis often need HCl too. You want to give, CalMag Plus probiotics is a good product. Strontium. Mainly, use vitamin D3 and make sure they have enough magnesium if they're taking vitamin D, and vitamin K2 are the two biggies. A number of companies make almost like multivitamins that are designed to help with bone. If you read Alan Gaby's book on osteoporosis, you see all the different constituents that are involved with making bone. It's a really good book. It's been out there for a while. I hope it's still in print. But similarly, I've had patients where I've given them the D3 and the OsteoB Plus is the biotics bone product, and K2, and still not get anywhere. Add hydrochloric acid to the mix, and I actually had a few people increase their bone density with that. I thought I'd bring up vegans because, like I say, a lot of vegans become that way because they're hydrochloric acid deficient. And vegans as a group tend not to be really healthy. Most of them don't know how to eat um, to make up for what they're doing. They need healthy gut to get B12. It's the MCV over 90. Give them 2 to 4 milligrams of B12 orally. They'll be deficient in sulfur-containing amino acids, especially any essential amino acids. Biotics makes a product called Amino Sport, which is a amino acid supplement. They tend to need zinc. In a blood chemistry, is the alkaline phos below middle range. That means they need zinc. Test vitamin D. D3 is in animal products, not plants. So you get D2, and they need enough sun. And now we're terrified of the sun, so we don't go out with SPF 100 in a flannel shirt. So there's a lot of D3 deficiency. So you want to test that. Iodine. Vegans have trouble getting iodine. You can test for that. There's Hockler Research's number. The next two categories in symptomquiz are need to heal the intestinal mucosa and gut dysbiosis, the wrong kind of bugs growing in the gut. I'll kind of talk about them interchangeably. If you listen to webinars from the labs that do gut testing, and there's a few vitamin companies that's their thing. They make it sound like if you're not treating the gut, you're not doing anything. In a way, that's true. The leaky gut's about inflammation. Inflammatory markers go way up when you have an unhealthy gut. You can make an argument that if you heal the gut of anybody, to prevent COVID flare-up, you're doing them a lot of good. Other symptoms include IBS and SIBO, allergies, autoimmune disease. That's the first place you want to look into. See, chronic fatigue syndrome, fibromyalgia. A lot of these people have gut issues, just plain sick. People just don't feel bad. They have multiple symptoms. And also, there's a very strong connection between the gut and mental health. They're finding the whole thing with anti-anxiety medication and antidepressant medication. That stuff is improved, and the pharmaceutical industry has been shown to fudge their data. I mean, they did it with the pain control medications, and it's looking like the mental health approach is the same way. I often wonder, Prozac was invented, what, 1988, and you look at the number of shootings we've had back before then and compared to now, and you wonder, I wish somebody would look at what drugs these people are on. You can take the gun away, but you still got a guy that wants to kill a bunch of people, and where'd that come from? And they have been associated with suicide, so why not murder? They might be creating a bigger problem than we realize. Talking about gut health might be one of those things that intimidate people from getting into this kind of work. If you read the medical stuff, it's sort of like, oh my, isn't that interesting? There seems to be something there, but they haven't proven anything. Kind of like that they told Semmelweis about washing hands between surgeries. But there is a zonulin protein that increases with leaky gut. Once again, that's controversial. You can test for lipopolysaccharides, which are from gram-negative bacteria and will increase. Interesting thing is if like you eat a McMeal and you test for lipopolysaccharides, within a few hours it goes up, and the levels will stay high for a couple of weeks. And one of the reasons our diets are so bad, like a lot of times people eat a bad diet, they'll start improving it and they won't get the kind of improvement that they need because they've done so much damage to the digestive tract. The other thing I would say is people that are into healing the mucosa and fixing leaky gut, make it sound like everything fixes it. The thing is, you can take that as an approach and you'll do well with most things. The one thing I would say is they don't tend to look at hydrochloric acid very much. They look at the pancreatic enzymes, but not hydrochloric acid. And I think that's a big piece of the puzzle. And I know Goodhart, general gut treatment was eat a big chopped salad twice a day because the bacteria that are desirable need vegetable fiber, and polyphenols will help them to grow. And then if your upper GI digestion is well, then you're going to tend to have a healthy gut. And that's kind of a good shotgun approach, and you can fine tune it from there. Once again, if you do that and it's not enough to get your patient better, you have time. This is not emergency medicine. Once again, if you want to heal the intestinal mucosa, fiber and polyphenols, we're talking about vegetables. I've had people tell me that, oh yeah, but it feeds the bad bacteria too. And a lot of times they'll give a prebiotic, which feeds your good bacteria. And once again, a lot of this stuff is controversial. People don't tend to agree with each other, but don't let that intimidate you. Try a prebiotic. Try the vegetable thing. You're at least going to get some improvement. The other thing that I want to stress is treating digestion from north to south. If they're not making enough enzymes, if they're not making enough HCl, things will tend to do badly further down the line. So it's a good idea to look at that. Glutamine's been used a lot, high dose. You need a pretty high dose. You need several grams of it. And it's also a good idea to take B6 with it. Phosphatidylcholine heals cells. Bone broth is a common, have them make a bone broth and drink it 2-3 times a day. Branched chain amino acids are used, the body uses them to make mucus, which protects the gut lining. Probiotics and prebiotics are good. With the branched chain amino acids, once again, if they're not making enough hydrochloric acid, they're not going to make enough mucus to protect their gut lining. So, and then the other category is microbial issues in the GI or dysbiosis. Wrong bugs will tend to give you leaky gut and that sort of thing. And once again, we're getting into some controversy here. Some practitioners say, oh yeah, you don't go ahead and kill bacteria because you're killing the good guys too. Some people will go ahead and bomb everything, kill the bugs and try to regrow a better quality bacteria. But if you have the right kind of bugs, they remove toxins, they nourish the intestinal lining, they even produce vitamins, and they keep the pathogens in check. One of the reasons you take probiotics isn't that you want to fill, this is going to be my whole microbiome, but they tend to act like policemen and keep the bad guys in check, and they produce things that favor a good microbiome. And one approach is to take a good probiotic and a good prebiotic, because you want to increase diversity in the microbiome. Different lectures will tell you, eat, the whole chopped salad, multiple vegetables, and they will say even eat vegetables that you're not used to. If you don't eat bok choy, eat bok choy, because if you add a variety to the kinds of vegetables that you do, you're going to increase the diversity in your microbiome, and there's some truth in that. The other thing is organic food. Glyphosate sprayed on everything is one of the reasons you stay away from grains. Glyphosate disrupts the microbiome. And we're in a chemical soup, and like you're not really treating disease. You're trying to undo this damage that's been done to the body. And with the digestion categories, I want to say you won't necessarily have GI symptoms, allergies, fatigue, fibromyalgia, depression, anxiety, and they'll say, no, I digest fine, autoimmune disease, like you start with the gut, you get into chemicals, you get into trace nutrients and other things. People that are just plain sick, people that come in with 20 different symptoms and they've confused their doctors a lot of times that they need some digestive support. Last time we talked about diabetes, type 2 diabetes, and gave you some supplements to do it. Diabetes can happen because of problems in the gut. One of the reasons people think that berberine works is because it kills undesirable bacteria. And once again, you're getting into a controversy. Do I kill the bad guys? You have to kind of work it out for yourself. So a few strategies in dealing with GI issues. Heal the gut from north to south. If they're not digesting up top, they're going to have problems further down the line. Gluten and dairy are almost always a problem. Grains in general, they tend to be heavily sprayed with glyphosate. I've actually seen patients, I went to Europe and I could eat wheat and I can't eat it here. This could be because of the spraying that goes on here. In the Roadmap to Health, we recommended no complex carbs. Once again, we're getting into controversy a little bit because certain beans and things like that actually act as prebiotics. They will feed good bugs for you. The reason we do the no complex carbs for a period of time, which is the paleo diet or Elaine Gottschall's diet, is if you're not digesting those things from your pancreas, then they do tend to rot further down the line. This is a temporary thing, and you may find that as people come off of the no complex carbs from the Roadmap to Health, they don't do so good with grains, but some beans and things like that will help. Once again, vegetables and fruit, polyphenols and fiber, probiotics. They're the policemen of the GI system. They can help. And you want to get chemicals out of the body as much as possible. And just taking this as a general rule, it's easy to add a lot of supplements. I mean, you can take probiotic, prebiotic, digest, before you know it, patients taking 8 different kinds of supplements. One of the reasons I recommend the Roadmap to Health is we want to keep the supplements to a minimal and then you use them for targeted things. Once again, you'll make your own decisions. Talk a little about irritable bowel syndrome and small intestine bacterial overgrowth a bit. This is a controversial treatment. It's something that I've used that works. I've been told, oh no, you have to, gently foster the normal bacteria. There's Epstein-Barr viruses linked to this. But this is kind of a quick and ugly thing from Harry Eidner that does work. And it's a good thing to be treating in your office because the medical treatment is the FODMAP diet, which you avoid certain foods. It's like you need a slide rule to follow the thing, and it doesn't work very well. And the argument for the FODMAP diet for SIBO is that it's checking bacterial overgrowth. Well, my argument is, well, if you've got too many bacteria, the wrong kind of bacteria growing, why not just kill them? The reason is that the patented methods they have for killing bacteria cause more problems than they solve. So they use the FODMAP diet because herbs don't work, just like washing hands between surgeries didn't work in Semmelweis's day. So, I mean, these people have abdominal pain, discomfort, nausea, bloating, indigestion, gas, diarrhea, constipation. Sometimes they'll lose weight. They're tired. You know, their GI is giving them a lot of problems. And I'm going to share with you a treatment from Harry Eidner. Okay. And he wants a low carb diet. I mean, it's 40 to 80 grams a day of carbs and no complex carbs, kind of like the Elaine Gottschall thing or paleo thing. And then a variety of things designed to kill microbes. These are all Zorex products. Emulsified oregano oil, 3 to 5 drops in 6 to 8 ounces of water 3 times a day. Berberine capsule 3 times a day. CGF, which is an insulin insensitivity program. He gives those 2-3 times a day. Olive leaf, another antimicrobial, 2-3 times a day. And KI caps, which is a fairly high dose of iodine. Iodine is also antimicrobial. So he gives all those for 2 weeks, and then off a week, and then 2 weeks on, a week off, and then 2 weeks on, and then you're done. And so he does it through 3 cycles. I've done this, and it works pretty well. During the week that the patient is not taking the other supplements, you give them Saccharomyces boulardii twice a day. Saccharomyces will kind of crowd out other things. And when you're done, you give a prebiotic and a probiotic formula. Microbiome Lab seems to have very good probiotics. It's an interesting company. You should look into them. They've done a lot of research on the validity of their stuff, and they also have great educational material. Once again, like all other webinars, even this one, you come from a point of view. Goodhart said that when you're looking at a health problem, it's a lot like blind men looking at an elephant. One guy is on the side, so it's like a big wall, and the guy's on the other, on the tail end, and he says, "Oh, it feels like a bottle brush," and the guy in the front says, "No, it's like a big snake." And we're all looking at different pieces of the puzzle here. And everybody's right and everybody's wrong. Things will vary from patient to patient. And when you look at some of the webinars, it sounds like, oh, you ain't doing nothing unless you're doing this, and that's not really true. It really is peeling an onion or straws off the camel's back. You have to find what helps each individual patient. You try something and are you better? Just real quick, I put together, if you don't want people going online, I put together a wellness quiz handout with kind of like cookbook treatments. This is the same thing, peeling the onion. If you want a wellness program in your office, you can do that this way. And this works because, like I said, you're never wrong. You give them the roadmap to health diet, you give them some basic supplementation. The patient's going to improve. Some people will get completely better. The other ones will teach you something. And there's also a handout for improving your results. I hope this was useful for you. I want to stress, just get started, do something. You really are fixing infrastructure. I think you'll be surprised at how well certain simple things work. If you need any help or any information, marketing materials, anything that you need, there's my contact information. And thank you very much for taking time with this.